हेलो हाय आदाब और सत श्री अकाल और एक बार फिर से आ गया हूं मैं आप लोगों के बीच आपका हमराज आरजे अभिनव 90.4 मेगाहर्ट्ज कम्युनिटी रेडियो ज्ञानवाणी यानी कि ज्ञान की वाणी पर। आज आप लोगों के वही स्पेशल शो आज ही के दिन जो कि है नो योर फैकल्टी। जैसा कि आपको पता है हम हर बार हर एक स्कूल से एक डिपार्टमेंट से एक फैकल्टी को आपके पास लेकर आते हैं और उनसे हम सवालात करते हैं उनकी लाइफ के बारे में, उनकी जर्नी के बारे में और कुछ वैसे भी सवालात जो बातें आप नहीं जानते थे, उनके स्टूडेंट्स नहीं जानते थे। तो आज मेरे साथ एक और ऐसी ही शख्सियत है, उनसे मैं आज आपका तारुफ कराता हूं, इंट्रोडक्शन कराता हूं और उनका वार्म वेलकम करता हूं, जिनका नाम है डॉक्टर वनश्री नालावडे, जो कि असिस्टेंट प्रोफेसर हैं स्कूल ऑफ ऑक्यूपेशनल थेरेपी में और वो हैं आज हमारे साथ। उनके बारे में कुछ और बातें। शी हैज़ डन हर अंडर ग्रेजुएशन इन ऑक्यूपेशनल थेरेपी फ्रॉम LTMMC एंड मेडिकल कॉलेज शाइन एंड मास्टर्स इन ऑर्थोपेडिक कंडीशंस फ्रॉम Seth GSMC and KEM Hospital, Mumbai. After her masters, she joined this esteemed institute D Y Patil Deemed to be University since 2015. It's been 8 years since she is associated with this institute. Her field of expertise is rehabilitations in orthopedic conditions, hand injuries, sports injuries, etc. In her tenure as assistant professor here, she has published 7 research studies and delivered presentation at various conferences and webinars on rehabilitation in orthopedic conditions. Ma'am, good morning. How are you? और कैसे हैं आप? And very warm welcome here in Navnadi.
Thank you so much, sir, and thank you for having me here on behalf of School of Occupational Therapy. I'm doing good. I hope you are doing well.
Oh, definitely, my pleasure. और अब वही एक सवाल जिससे हम लोग शुरुआत करते हैं, आप सभी वहीं से शुरुआत करेंगे. Tell us about your journey here at D Y Patil University. When did you start working here, and how have you evolved as a teacher and human being?
Okay, so after I finished my PG, I was working in a clinic in orthopedic setup only, and then I got a call saying there is a vacancy here, and I joined. So let's say after 4 months post my post graduation, I joined here, and since then I've been working here as assistant professor at School of Occupational Therapy. And working here has really evolved me into a really good therapist. As we say, we are professionals, so our job is to deal with patients, and as academician our job is to deal with students. So both parts, I got good opportunity here at D Y Patil Deemed to be University, because as we all know, it has its attached hospital as well.
Oh yes.
So I could evolve as occupational therapist as well as a teacher.
Okay, great. What made you choose the field of occupational therapy? How did you prepare yourself for this since school and college days?
Actually, I honestly did not know much about occupational therapy at our times, but my general physician, family doctor, she had advised me about this.
Okay.
So I knew there are 2 courses in rehabilitation, occupational therapy and physiotherapy. And then I chose this because it focused more on the overall development of patients, rather than just seeing only physical aspects of patient.
Okay.
So then I thought of doing this, and luckily I got it as BMC seat here in the government college, so I could pursue my UG. Then I got guidance, and then I could choose my field of expertise or area where I can shine. So then I choose orthopedic conditions, and I did my masters in that.
Okay. Dr. Vijay Patil sir is an inspiration for all of us. How has he motivated you?
In many ways, so many ways, because it is not easy to manage so many things, and we all know when you expand your goals, the responsibilities also increase.
Yes.
He has such a good vision that what D Y Patil sir had started, he is continuing and he is improving. He is improvising in that. So there are so many new schools now or new projects that sir is working on.
ओके अब कुछ क्वेश्चंस जो मेरे पास हैं वो हैं आपकी फील्ड से, वो मैं आपसे पूछता हूँ. ओके, द क्वेश्चन इज दैट व्हाट कॉमन मिसकंसेप्शंस अबाउट ऑक्यूपेशनल थेरेपी डू यू एनकाउंटर एंड हाउ डू यू एड्रेस देम इन योर प्रैक्टिस?
Correct. That's a very good question actually, because I told you rehabilitation के 2 primary fields हमारे occupational therapy and physiotherapy है.
Okay.
So many a times when I'm practicing in ortho conditions, I get to see these questions such as what is the difference between you and PT, or what special role you play.
Oh yes,
So
oh yes.
usually how I tackle these questions कि exercise is a part of our rehabilitation. जो PT भी of course करेंगे, हम भी करेंगे.
Oh yes.
Apart from that, activities, occupation, जो वर्ड है जो हमारे कोर्स में है, जो डेफिनेशन है, दैट मीन्स दैट आई हैव टू डील विद देयर ऑक्यूपेशनल इम्बैलेंसेस. तो जो भी प्रॉब्लम है उनको रिगार्डिंग देयर डेली रूटीन एक्टिविटीज और वर्क, मेरा मेन एम रहेगा अर्ली रिटर्न टू देयर रूटीन एंड वर्क इन. हाँ, तो कंसिडरिंग दैट मेरा सिर्फ एक्सरसाइज एक कॉम्पोनेंट रहेगा ट्रीटमेंट का, उसके अलावा एक्टिविटी मॉडिफिकेशन, एक्टिविटी ट्रेनिंग, ये सब हमारा पार्ट रहता है इन द ट्रीटमेंट.
ओके, ग्रेट. And second question, could you share a memorable success story or case study that illustrates the transformative impact of occupational therapy on an individual life?
There are so many examples. I'll just what I remember fondly. दो examples है ऐसे. One patient here at DY only. Okay. He had operated at KEM hospital. And spinal cord injury एक ऐसे रहता है कि severity पे depend रहता है.
Yes,
तो post surgery that patient was bedridden. And of course you know in India so much population की public hospitals में उतने देर लोगों को नहीं रख सकते. So then he sent back at home. उनको proper rehab नहीं मिला था and he developed post operative complications. He developed bed sore, जो हम एक बोलते अल्सर, लेटे लेटे अल्सर वुंड हो जाता है.
Yes, definitely.
And वो इतना deep हो गया that he had to take medical opinion again and he had admitted in DY. So DY में that surgeon contacted us कि you know occupational therapy department कि ये एडमिट तो है ये अल्सर के लिए, बट कैन यू हेल्प हिम इन स्पाइनल कॉर्ड इंजुरी रिहैब. एंड देन यू वोंट बिलीव दैट पेशेंट केम हियर bedridden and he went there walking.
Oh wow, wonderful.
So when he got discharged from hospital, he was walking of course with walker. Then he after discharge he used to come to OPD. और अभी ऐसे है that you know he can walk independently. He has joined his work also.
Wow, great.
अभी थोड़ा ऑफ कोर्स थोड़ा सा हैंड में यू कैन सी द डिफरेंस, बट एटलीस्ट उसका,
बट एटलीस्ट एक्चुअली ये एक प्रोग्रेस.
यस, और उसका वही है कि दैट आई कैन एटलीस्ट वर्क एंड फीड माय फैमिली नाउ, जो कंप्लीटली डिपेंडेंट थी उन पे. तो वो एक बहुत अच्छा है. अभी उनका फैमिली रिसेंटली एक होम मिनिस्टर प्रोग्राम आता है मराठी, उन पे वो फीचर आए थे उनके फैमिली.
नाइस, वंडरफुल, दैट इज अ ग्रेट सक्सेस स्टोरी डेफिनेटली.
एक स्मॉल एक दूसरा कि एक पेशेंट शी वाज बैडली और यू कैन से affected with frozen shoulder. ये हमने टर्म बहुत कॉमनली सुना है. तो since 2 years she was struggling with that shoulder pain, and when she came to me within a week she said I could sleep. You know, forget about all the other improvements कि आपका हाथ ऊपर जाने लगा है, आप खाने लगे हैं फिर से, or have you started using your hand previous life or not. वो छोड़ दीजिए, but she said that I could sleep in 2 years peacefully. मुझे पेन नहीं हुआ.
Oh wow.
So I think that is something that we want to see in patients.
Yes, that is the achievement actually, their relief. Okay. What makes our institution unique? Of course, it's a faculty like you, but what about the factors such as infrastructure, cafeteria, lab and research facilities, the varied courses and the general environment of learning and fun?
Correct. So regarding infrastructure and cafeteria, we all know we have a state-of-art facility here. So if you compare like where I have studied from the BMC
that is a big change.
So yes. So for us, we envy our students कि you know इनको कितना अच्छा facilities and सब कितना अच्छा मिल रहा है.
Yes, yes.
Compared to what we had of course. And then lab if you see तो digitalized भी है, सारे उनको online journals, online papers का access है, जो बहुत उनको studies में help करेगा. To be competitive with the other, जैसे यहाँ पे occupational therapy students है, वैसे बाकी के institutes में भी है. तो to be with par with the other student, जो knowledge resources चाहिए वो resources डी वाई पाटिल प्रोवाइड करता है. जो उनको comfort चाहिए वो infrastructure प्रोवाइड करता है. जो आपने फैकल्टी का बोला तो they also you know encourage us, or sometimes it is mandatory for us to you know be at par with other faculties of other institute. So we have to build our CV in such a way that you have to do publish papers or you know publish your studies, present your papers and conferences. तो वो constant pressure भी रहता है that हमें वो competitiveness maintain करना है. तो वो faculties भी वैसे ही level के फिर वो बच्चों को मिलते हैं.
Definitely. You are right. Okay. If you had not been a professor, you would be?
I think dancer or maybe yoga teacher.
Oh, actually, that's nice. Okay. What is your greatest lesson you learned from your students?
स्टूडेंट्स तो हमें काफ़ी कुछ सिखाते हैं. बहुत बार उनके जो डाउट्स रहते हैं, बिकॉज ऑफ देम वी लर्न अ लॉट, वी रीड अ लॉट.
Sure.
तो दैट इज समथिंग दैट वी हैव लर्न कि यू नो रिसेंट एडवांसेस कुछ है दैट दे विल टेल यू. अभी ऑनेस्टली वी आर लिटिल टेक्नोलॉजिकली हैंडीकैप कंपेयर टू द यंगर
Oh, definitely.
जनरेशन.
They are actually having these technologies and all the things when actually they are opening their eyes.
हाँ, so they will introduce us to different recent technologies that they must have come across through on Facebook or on Insta, and they will tell you, ma'am, हमने ऐसे देखा था, what is it? Then we have to read and search about it. So that has helped to gain knowledge in our current knowledge basis.
Okay. How do you juggle your hobbies with your career?
हॉबीज एज सच, एज आई सेड आई लव डांसिंग. तो जैसे संडे मिल गया है तब कर लिए है, या कोई छुट्टी के दिन कहीं ट्रैकिंग पे निकल लिए. तो दैट वे यस, एंड आई फील दैट दिस जॉब हैज़ गिवन मी गुड टाइम दैट आई कैन फोकस ऑन माई हॉबीज और माई फैमिली.
Okay, nice. So moving forward for our famous rapid fire round, I think you're ready for that. Okay. The best advice you got in your career?
That work with honesty, 100%.
Okay. The happiest moment of your life?
So many small moments. So
Okay,
many.
so you can actually pin up, but yeah, so many moments.
Whenever we get results, good marks in exam or something in family, any achievements.
True. Okay. The saddest moment of your life?
Again, there are so many, you know, so many times we feel demotivated.
But you actually learn from them and you move forward.
Yes, we have to move on. Correct.
Okay. Challenging moment of your life?
Challenging, जैसे competitive exams या any presentations if I have to do at conferences, or if I have to present something, I take that as challenge कि I have to, you know, do my 100%. उसके पीछे पढ़ना है ऐसे.
Okay. So आपको सिनेमा से your favorite actor?
My favorite actor Akshay Kumar. I like him, and Anil Kapoor.
Oh, nice. Okay, your favorite book?
Book, I'm not much into reading, but Harry Potter एक book है
Harry
which
Potter
I
series,
have
oh, yes.
enjoyed.
Okay, great. Your favorite movie?
Movies है, but I like जब भी met.
जब भी met.
बहुत favorite है मेरी वो.
Okay. Favorite food?
Food, all types of food, but tandoori chicken, or yes.
Okay, nice. Great. Favorite holiday destination?
The one that I have seen, उसमें I like my village, Ratnagiri. There I have enjoyed, and I want to see Kerala.
Kerala has so much greenery, definitely. Okay. So there was a rapid fire. अब मैं insights कुछ पूछता हूँ आपकी life के, an idea that changed your life.
Idea, I feel that if you give 100% from your side, na, you are going to get 200% from other side.
From other side. Okay, wonderful. Great. आजकल लोग एक्चुअली इस पर कम बिलीव करते हैं, बट एक्चुअली यू आर द वन जिन्होंने एक बात बताई है वाली. ओके. हाउ सक्सेस हैज चेंज यू?
चेंज नॉट मच, बट हाँ, एक मुझे थोड़ा सा यू कैन से गिल्ट है दैट आई कैन नॉट गिव मच टाइम इन टॉकिंग टू माई फैमिली जितना पहले, बिकॉज ऑफ वर्क शेड्यूल.
Oh yes, okay. The best role of your life, mother, daughter, wife or teacher?
As a person, I guess, everywhere.
Okay. What hurt you the most?
Hurt, I think the what we say, the behavior of others, you know, how I feel everyone should behave politely and nicely. So I think that behavior, if it is from the other side, actually, if you see that they are so much rude, rudeness is something, I feel little disturbing.
Okay. Moving forward for this or that round, I'm giving you the option. You have to choose one. Okay. Veg or non-veg?
Non-veg, of course.
Okay. Tea or coffee?
Coffee.
Gym or yoga?
Yoga.
Okay. Early riser or night owl?
I am actually sleepy. You can say I can sleep early also, and I get up also late. So.
Oh, okay. Emotional.
Rest with sleep, you can say.
Rest with sleep. Okay. Emotional or practical?
Practical.
Okay. Books or Kindle?
Books.
Religious or spiritual?
Spiritual.
Okay. Mountains or beaches?
Beaches.
Okay. Library or classroom?
Classroom.
Amazon Prime or Netflix? ये आपके लिए रखा है.
I don't have subscription from Prime right now, so Netflix.
Okay. वंडरफुल एंड इट वाज
Genuinely, I enjoy Netflix.
ओके ग्रेट। हाँ वही मतलब जहाँ जो अच्छा एक मटेरियल मिल गया, बट एक्चुअली यू लाइक द नेटफ्लिक्स मोर क्योंकि वहाँ ज्यादा आपको अच्छे कंटेंट मिलते
I
हैं।
keep watching Big Bang वो लूप में और फ्रेंड्स ऐसे।
नाइस नाइस नाइस, डेफिनेटली। तो ये थी आज मेरे साथ डॉक्टर वनाश्री नालावाडे, जिनसे हम लोगों ने काफी ज्यादा बात की और जरूर आप लोगों से जल्दी मुलाकात करेंगे यहाँ पर हम 90.4 मेगाहर्ट्ज कम्युनिटी रेडियो पर। थैंक यू सो मच एंड थैंक यू सो मच वनाश्री, यू
Thank you sir for having me here.